Okay, so continuing that adolescent, as they're pulling away from that parental authority and really establishing their own identity separate from that parental authority, they are increasingly um, dependent on and looking to their peers, and they develop best friends. They have that sort of longing to belong to a group of, um, like I said, like-minded individuals, and and interestingly, social media is playing a huge role in this, and technology. And I think we've only honestly touched the surface of this, because it's only going to get more and more intense in our society, and social bullying and things that never existed 10 years ago are now um, catastrophic almost in this age group. And so I always ask about bullying at the well visits for adolescents, and ensure that um, they are screened for depression, and those types of things, so that you can pinpoint those kids that are at risk. Okay, so they start dating. They're defining their sexual orientation. They might have sexual experimentation, and so it's always important when you are seeing an adolescent for a well visit or a sick visit, whatever it may be, that you don't just say, "Are you having sex?" You have to sort of be very specific and ask those specific questions. They're curious. Some of this is peer pressure to do things, and into that notion, I always talk, to about that to girls and boys, that they do not need to do anything because they feel pressured. They need to do it for their own, because it's what they have chosen to do, but not because anyone's forcing them to do it. This body image concept, they feel very, they're worried about their appearance, their how they come off to their friends. So acne is a big deal to them. One little blemish is a big deal to them. And, like this slide says, it's magnified out of proportion almost. And, now all of these peer pressures to fit in, and have the best and the greatest, and all of those things. It's a lot of stress on the adolescent to fit in. So I sort of touched on this a few minutes ago, but they're very concerned with, are they normal? Are they doing what they're supposed to do? Are they like their friends? And odds are they're talking a little bit about it to their friends, but not completely about it to their friends. So you always want to be on the lookout for those male and female that are looking for that perfect body. You're asking, are they eating 3 meals a day? Are they eating breakfast? What are they drinking? You're looking for those red flags that might indicate an eating disorder, or some sort of psychological concern that might have to do with this body image and puberty. Promoting this optimal health. So in that adolescent period, we are looking for health risks. Okay. What risky behaviors are they doing? We're screening for depression and anxiety. We're boosting them with immunizations, getting them ready for college. We're making sure that they're eating healthy, and that they're getting enough of the micronutrients that they need, which most of them are not. You can assume that they are not drinking enough water. They're not getting enough micronutrients, and they're not eating well. So you're encouraging that. You're encouraging them to floss and to brush their teeth twice a day, and to see a dentist, and all of those things, to get good rest. I always bring up texting and driving and things like that, and because that's reality now. Okay, so yeah, Vision and hearing, we're still checking that. Yep, you're talking about body piercings. Yes, sun tanning. I'm always asking about that. Not only are you going to a tanning bed, but are you wearing sunscreen outside? And all you can do is continue to reiterate and to encourage that for them. Talking about sexual health and education and protection, and just making sure that they're safe, taking precautions to protect their privacy. That can get very, very touchy in the adolescent well visit. And the best way I've sort of found to sort of talk to them and protect their privacy is, to ask a lot of questions with mom or dad in the room. But then once it's time for the physical exam, I go ahead and ask mom or dad to step out. And then at that time, I always ask them, is there anything you want to talk to me about that you don't feel comfortable talking to anybody else about? And I express to them that, of course, of the privacy and that type of thing. And then I ask them about drinking, drugs, sex, anybody hurting them, are they depressed, all of those things. And you can do it pretty quickly and pretty efficiently. Injury prevention, again, motor vehicle, so wearing your seatbelt. The biggest thing here now is texting and driving. So, I actually make them make a pact with me and look me in the eyes, and that they're going to leave their phone in their purse or in their bag or somewhere. Firearms, sports injuries, tobacco, drugs, all of those things, are big topics for the adolescent visit.